how much sleep do we need is always a hot button topic that I get asked a lot. I have people that say they need, 9 to 10 hours per night. I have other people that say they do 5 to 6 hours and they feel great, and they kind of wear that as a badge of honor. Whenever I get that question asked, I do tend to feel like we need to get into that 7 to 9 actually, hours of sleep. So if we look at the chart here, we can see that as we age, we require less and less sleep. So the newborns are obviously going to sleep quite a bit in the newborn phase, and it starts to decrease as we get into toddler phase, preschool, school age, teenage years, and then as young adults and adults, we can really get at the most maybe 10 hours is appropriate. At the least, maybe 6 hours. Again, this comes back to looking at our sleep architecture that we talked about in the initial lecture series. Was if we get through 5 full 90-minute sleep cycles, that's going to be right at that 7.5 hour mark. Some people can get by with 6, but I tend to think that they can get by in the short term. But chronic lack of sleep does put you at more risk for different type of injury or ailments and injuries and cognitive decline and that sort of thing. So I do recommend trying to get in between that 7 and 9 hours as an adult, young adult, in terms of the amount of sleep that we get. And then we always get this follow-up question, well, is one bad night of sleep going to ruin me? No, it's not. It's this prolonged chronic phase. We've all been there where we don't get sleep, whether you're traveling, you're stressed from life, you have a newborn baby, they're sleeping, you're not. You have things happen, right? We get bad nights of sleep all the time. But what happens when you get that chronic lack of sleep? So healthy individuals, age range 30 to 70, who sleep less than 6 hours, and this is again, chronically, where it's day after day they're getting less than 6 hours, have a higher risk for mortality compared to those with adequate sleep. This next study says cognitive effects of poor sleep can be as profound and dangerous as drunk driving. There are other studies that also suggest this, because our focus decreases, our reaction time decreases, and you can actually go into what they call these micro sleeps. So with a drunk driver, you have impaired reaction time. So you're driving along and someone runs in front of you, you see them, but it takes a while for the brain to tell your foot to hit the brake. Whereas if you are getting these micro sleeps through the night, you can have your eyes open, you can have this micro sleep, and you won't have any reaction time. You just keep driving. So it's not delayed, it's just not even there. So I would actually argue that you could be even more dangerous as a impaired sleeper as you are a drunk driver. Sleep deprivation leads to decline in auditory and visual spatial attention. Again, you're at a higher risk of injury, hurting yourself, hurting others, and all because of just a chronic lack of sleep. Looking at this study, the results indicate an increased likelihood that a person who is sleep deprived will perceive an experience as negative instead of neutral or positive, affecting the emotional brain, affecting what we experience day after day because of chronic lack of sleep. So when we look at this, if I wish I could make this bigger, after one night of bad sleep, you'll see in the green on the right hand side, you may be hungrier. Again, you don't have that hormone that helps tell you that you're full. You're more likely to have an accident because your reaction time has decreased. You don't look your best. You're not as approachable. You might be cold, or you might have a shorter temper. and you start to get more emotional, and you start to have maybe memory problems that day. That's why staying up all night cramming for an exam as a college student or high school student or even as an adult for anyone taking classes is not the best strategy, because you can actually have impaired memory. Yeah, maybe you do okay on the test, but two days later you have no recollection of what you studied for that test. Now, if you have the chronic sleep deprivation, which we've been talking about, you have a 4 times risk of stroke. The risk for obesity jumps, which goes along with the inability to control our hormones of hunger. We have an increased risk of cancer. Diabetes risk goes up. Heart disease increases. Sperm count decreases. And your overall risk of death increases. So this chronic lack of sleep doesn't just affect your mood, doesn't affect your memory, doesn't affect your recall. It affects your entire system. It affects how well your blood's flowing, how well your brain's functioning, and all of this because of a chronic lack of sleep. So sleep is very, very important. I can't stress that enough. If you're having difficulty with sleep, we do have a lecture as well of different things to kind of tweak or to integrate into your sleep routine that can help you sleep better.